Okay.
Thank you. So we'll call the meeting to order. We will not approve the minutes because we don't yet have a quorum, but I will ask Rhonda to proceed with the Community Health Improvement Plan update.
Good morning, everyone. Actually,
Oh,
I have our
Rhonda, can I
Yeah.
just say something real quick? I just want to take an opportunity to center Rhonda. Rhonda, how long has your leadership over the Department of Health's portion of the reaccreditation been? How long have you been working on this?
For this round, we've been working on accreditation for well over a year now.
Okay.
Yeah.
And I know that isn't true because when I took the job, Rhonda was one of the first people to request a meeting with me to show me the extensive amount of prep for the year that she is referencing. So I just really want to center Rhonda. And you always say that I do this, but when I obviously asked that she have the opportunity to do this specific presentation because of the significance of where it says we are, she insisted that another team member who she valued and whose contribution had been there. So I just want to be intentional because Rhonda will not be doing this presentation at her own request, to just say a little bit about Rhonda's level of preparation, the 30+ years she's been at the city, the dedication, the way that I'll have, Rhonda is also what I would refer to as our in-house historian. I can ask one question about something that happened 17.5 years ago in the month of July on the 3rd, and Rhonda will follow up in my inbox with something from one of her archive folders that she's kept. She has such passion for the city and for public health. She has an extensive training background, but is also self-taught because of limited resources. And her leadership in this regional collaborative with our county and stakeholders just really we need to spend some time to just give Rhonda her flowers, because this is not a job that everybody's happy with you. In fact, there's a few managers that are just a little bit tense right now, but should have probably started earlier. So just wanted to take an opportunity to just thank Rhonda and acknowledge her leadership as she is in the final stages of getting us and the region across the finish line. Thank you, Rhonda.
Well, I appreciate those kind words very much. But of course, you can't be successful without a successful team. So Shantae and Matt are both on here too. So please acknowledge them. Also because they have been wonderful in our efforts with accreditation and with preparing our CHA and our CHIP. And Matt actually, he's a very talented epidemiologist with the department, and he put together this presentation. So I felt only to honor him and allowing him to give this presentation that he worked so hard on. And I thank you. And Matt, you want to take it away?
Yeah, of course. Thank you, Rhonda. Right, can everyone see that all right? Perfect. So thank you for those kind words, Rhonda. And I'm excited to present to you all today the St. Louis Region 2022 Community Health Assessment and 2023 to 2027 Community Health Improvement Plan. And today I'll be highlighting how these two processes really work hand in hand to understand and measurably improve the health of all residents in the St. Louis region. And this assessment really reflects the work of numerous community partners and organizations as a part of the St. Louis Partnership for a Healthy Community. So the purpose of the CHA, we'll start the community health assessment, is to determine the health status of residents in the St. Louis region and to understand the factors that contribute to health issues, to identify areas for health improvement and establish what assets and resources can be mobilized to address the health of these populations. And so this partnership began This partnership began using the Mobilizing for Action through Planning and Partnerships, or the MAP framework, developed by the National Association of County and City Health Officials, or NACCHO, to guide this assessment. And the MAP process has 6 phases, which are shown below in Figure 3. And in the 3rd phase of this process, our partnership completed 4 assessments, which we'll kind of go through here one by one. So the Forces of Change assessment is the first assessment, and that's a qualitative assessment that really looked to contextualize the social, political, and economic forces that influence the regional public health system. And some of the major forces that were identified included increases in violent crime, citizen advocacy, structural racism and health inequities, housing conditions, underfunded public health infrastructure, and policy changes. The next assessment was the Community Health Status Assessment. And the Community Health Status Assessment is going to analyze all that quantitative data, particularly around population health, from a variety of primary and secondary data sources from across the region. And this data was used to identify important health issues and disparities across age, gender, racial, and population subgroups throughout the region. The next assessment is the Community Themes and Strengths Assessment. That's another qualitative assessment, utilizing focus groups and survey results. And those results were kind of conceptualized into 3 different categories related to accessibility, affordability, and acceptability. So regarding accessibility, the built environment and governance, or access to policymakers, were identified as key factors critical to improving quality of life. And barriers to accessing social benefits, high costs and copays, and income disparities were commonly raised issues of affordability, while common concerns related to acceptability in the region were racism, discrimination, and stigma, mental health and substance use, and a lack of support for vulnerable populations. And then the final assessment was the Local Public Health System Assessment, which measures the capacity of our region to meet those 10 essential public health services, as well as equity standards. And the areas identified for improving the regional public health system included the need to improve data sharing, increase community engagement, resolve workforce issues and funding, take an inventory of policy issues, strengthening our local partners, and ensuring that a strong system is in place for providing those 10 essential public health services. So based on these assessments and input from our community, the following priority areas and cross-cutting themes have been selected as the focus for the St. Louis Partnership for Healthy Community for the next 5 years. However, I do want to reiterate that the work in other areas critical to health is going to continue. So those areas that were selected are the intersection of health and economic mobility, chronic diseases, maternal and child health, violence prevention, and behavioral health. And on the next couple slides, we're going to walk through these relevant findings for each priority area from the CHA, and that'll help kind of frame some of our region's most pressing health concerns for each priority area. So for the intersection of intersection of health and economic mobility, some of the main issues that were emerged from the CHA were related to unemployment, home ownership, severe rent burden, business ownership, and the ability to improve income without impairing benefits. So in figure 19 and 20, we can see how unemployment rates and cost burden households are really going to vary by geography throughout our region. So we can see that unemployment rates for those 16 and over in 2020 were highest in areas of North County and North City, as well as some zip codes in Southwest or Southeast City and County. And that theme persists as well for cost burden households. We can also see in figure 21 that the percent of home ownership by race is really going to vary, the percent of home ownership is going to vary by race. So we can see that in both the city and in the county, white residents own their homes at a higher percentage than their Black counterparts. Related to maternal and child health, some of the key populations or priority populations identified in the CHSA included Black mothers and infants and mothers living in poverty. And some of the key indicators really are related to Black infant mortality, perinatal visits in the first trimester, and then the stigma perceived by Black parents during prenatal, natal, and postnatal visits. So we can see in figure 24, infant mortality rates are really going to vary by race. So from 2016 to 2020, we can see that the infant mortality rate for Black children was about 3 times higher than white children in the city and in the county. And throughout the region. Figure 26 and 27 note that the percentage of women receiving perinatal care in the first trimester also is going to vary by race and by geography. So we can see that white women are receiving perinatal care in the first trimester in a much greater percentage than Black women, as well as the fact that those accessing services access them via different locations. So we can see that those living in the city, particularly in North City, as well as North County, are not accessing those, are able to access those perinatal services within the first trimester at the same rate as some of the other individuals here in our region. For violence prevention, 2 of the main issues that emerged from the trial were related to gun safety and child mortality. And really highlighted that violence disproportionately affects Black children, Black youth and adults, as well as men and residents living in the northern areas of the city and county. Figure 29 shows that, like I said, young people are the ones who are really kind of bearing the biggest portion of the burden related to firearm mortality, especially in the city, but as in the county and throughout the region as well. Figure 30, we can see that those disparities once again exist by race, with Black residents dying at almost 4 times the rate from firearm-related mortality as white residents, and throughout the region at about 5 times the rate. Particularly, we also see for children, those aged 1 to 19, we can see that homicides contribute to a very large portion of childhood mortality. Particularly homicides in the city, but also accidents and suicides as well. For chronic disease, 2 of the issues that emerged from the CHA really related to the impact of environmental factors, particularly on diabetes and diabetes risk, as well as heart disease, and those disparities we've seen in other places, but particularly here in chronic disease as well. So figure 34 shows that chronic disease, particularly heart disease mortality, has been kind of declining and maintaining its rate for the city, but it's increasing throughout the county and throughout the region. And figure 37 and figure 40 point to the idea and the reality that heart disease is going to differ for men and women and by race. So we can see that men are disproportionately affected by heart disease, as well as Black residents. And then the last section is behavioral health. So 2 of the primary issues emerged from the trial were mental health and substance use. And of particular interest within these categories are depressive disorders, opioid addiction, and overdose. And so we can see in figure 17, the age-adjusted overdose mortality rate has really increased throughout the region from 2016 through 2020. We can see that disparities exist geographically for overdose mortality, and we can see that overdose mortality is really affecting residents in North City and throughout the city, as well as areas in North County. And we can see that mental illness treatment services also vary by race, with Black residents receiving treatment services at a much higher proportion than their white neighbors. And so kind of understanding these community needs and resources, as well as the assets that all our community has, each action team has really come together to create, I think, really thorough action plans. And so these action plans include goals and objectives, implementation activities, and responsible parties for each priority issue. And this table here presents kind of a high-level overview of these goals for each action team. And this is something we can definitely revisit at the end if people want to spend a little more time looking at these. And so how might this data from the CHA be used? And so there's lots of ways we can kind of use this data. One is to apply for funding through grants, and definitely an opportunity for health education, collaboration with our community partners, community members, and various organizations, as well as helping us to make evidence-based decisions and informing our strategic planning and how we kind of plan our whole public health system as a whole. And this data will be shared via the City of St. Louis website, the Think Health STL dashboard, as well as local presentations. There'll be a media release, and this is, like I said, is going to be incorporated into our ongoing work as a health department and as a region. And so the next steps are really to kind of continue doing the work, and going ahead and doing all the implementation and the monitoring and that whole process. So I'm sure we look forward to sharing that with you all at some point as well. So any questions? I'm happy to take those.
Can't see everyone, so if somebody has a question, you scroll through. Okay. I actually have a question. Oh, Tim, I see you. Go ahead.
Well, first of all, fabulous work, Matthew. As usual, this report is just amazing. One of the things you did at the end there was highlight what I wanted to see, which is what's going to be done with this in terms of dissemination. Because I think this needs to get out into the public, the community health assessment, one of the things I liked about it was that you combined a city and a county, and I work with the county on the Justice Services Board in other ways, and I've long been an advocate that public health doesn't stop at Skinker. So I think that we need to keep pointing that out, and a lot of your maps showed that. If we can continue to make that point, I was part of this CHIP group towards the end, and where we kind of pulled together some of these goals. Some of the things I think that really struck me are the opioid numbers on those graphs are just sort of alarming. The connections between all this and race, how you can take issues of affordability and economic measures, but when you break it down by race, it shows a lot of really key measures, and then the housing measures is what a lot of what we focused is. Racism. Thank you, Corey. Got to get my language right. Thanks, Corey. And so our board has spoken out before that racism is a public health issue. So I think this points to that. And violence is a public health issue, and you saw that on those slides. So I think this really brings that out front and center.
Thanks, Tim. Colleen, I see your hand is up.
Yeah, thanks so much. So there were lots of what I would say is disappointing but predictable findings in the assessment. I was wondering that if there's anything that you or the team sort of thought was surprising about the analysis.
I don't know necessarily if it's surprising, but I think one of the things I think that's really promising, and you can kind of see it throughout the goals, I think can kind of give us a lot of encouragement, is how much overlap there is, and how it really presents an opportunity for the areas of concern within economic mobility to overlap with chronic disease, and those to overlap with maternal and child health, to overlap with violence and behavioral health. So I think that was something I think it was really encouraging to see, is how much kind of overlap and opportunity for collaboration within the groups, because like Dr. McBride said, there's so much overlap between all these factors, the city and the county. So I think that's something that I think is really promising, an opportunity for us to really to collaborate and get out of our silos and to really work together as a region to improve some of these outcomes. I don't know if Rhonda or Shantae, you have anything you want to add?
No, I think you summed it up very well. I'd only be able to echo. So
All right. Thank you.
I'm sorry, Colleen, I just wanted to add, I mean, I think I have a different lens because of watching how difficult it is to try to distill priorities when you're coming out of a global pandemic where everything is urgent, everything is neglected. You know, what's not shown here is the pain points and some of the overt like disagreements about distilling this down that Rhonda can even speak to. It's a difficult work to try to prioritize everybody's perceptions, vocations, life's work, right, into one table. And so the work is not in a less than 10-minute presentation. The work is in the implementation over years that requires constant looking, constant thoughtfulness about a community participatory approach, right? So at a time when we can even talk about the syphilis numbers being one of the most alarming, right? That there's so many aspects and areas of it. So I feel like that's just a lot of nothing in a way, but I can tell you that there were a lot of pain points, disagreements, people fighting for, people getting upset about, which may not feel good in the moment, but reflects passion and intention and thoughtfulness. And that can be really, really tough. So, I don't know if that helps, Colleen, but I did want to transparently sort of reflect on that. And that's right. When everything is on fire, where do you start?
Okay, thank you. I see Imbal, and then I'm going to come back to Rhonda.
Thanks. Sorry, Matt, great work. Thank you. It was good to see you doing this work so beautifully. One of the thoughts I had to piggyback off of Dr. Monti's comment was, there's a lot of overlapping structural determinants that are grounded in racism. Are there levers across groups that we're able to be, that we can identify that change could happen? Sorry. To identify opportunities for change. Did you hear any of those?
Love that question. Rhonda?
Yeah. Matt, if you want to put up the cross sectional themes that were also developed with these priorities.
Give me 1 second.
There we go. So, so basically, those cross-sectional themes are areas that we want to focus in every single priority. So the racism, the access to systems and physical accessibility, looking at people across the lifespan, and community data-driven approaches, being trauma-informed. We really want to, as we go forward, encourage more community engagement with the priority, our action teams engaging more with the community, and hopefully getting more feedback and implementing like more focus groups to actually measure in the future, are the actions that we take and having impact on our community. So hopefully that answers your question.
Can I follow up? It doesn't actually, but I appreciate it as well.
Okay.
So I think I'm just thinking about, like, are there policy implications or identified policies that are decidedly racist or that over the lifespan can be identified and addressed? While I know there might be parameters from the Department of Public Health, are there things that whether you do it or you tell us to do it and say, how do we advocate for these types of changes? Those are the things I'm thinking about. You know, are there interventions at the community level that address multi-layers of and across the lifespan that could have, I mean, I'm thinking about like the universal income that's been implemented or that is in the process of being implemented at the city, that could change some of these outcomes.
Yeah, well, the community health improvement plan is actually in its very final stages, and there are some policy identifications by the action teams in that plan that they plan to take action on. And that's going to also be just an ongoing process, trying to evaluate and look at what, you know, policies are actually having an impact and what we can change and improve on. But there are several recommendations within the plan that we hope to share with you once we finalize and get that plan out.
Thanks.
Rhonda, there's a question in the chat that is kind of a follow-up to this, like the difference between the community health assessment and the community health improvement plan. Can you elaborate on that a little more?
Yeah, well, the assessment is actually the MAP process where we looked at data. Our epidemiologists looked at it across the region, you know, by demographics, gender, race, and all that. And so that's more of the health status assessment is all about data in the region. Then we looked at data through the other elements of the MAP process. And so the assessment itself is all about the data that we then use that data to inform our improvement plan. So the community health improvement plan is the result of the data and analyzing the data and getting engagement with our community partners and engagement with the community members themselves through focus groups and stuff. And all that data led to the community health improvement plan, which is our goals, our objectives, and our activities that we plan to do. Are the community partners, you know, the whole community system, we hope will get involved in implementing the recommendations, like the goals and the activities that are listed in this community health improvement plan.
Another point of clarity for the next steps, when I saw on the slide that we're going to release the community health assessment. Is that going to happen at the same time as the community health improvement plan, or are you staggering that?
Well, we have posted the community health assessment on Think Health STL, so it is already available. We do have a press release that we were going to put out within the next couple of weeks. And then also, because the community health improvement plan is coming out very shortly, we were hoping to celebrate Public Health Week the first week in April and really promote these two documents during Public Health Week in April. And that, of course, that would be led by our wonderful leadership at the county and the city, Dr. Motti and Dr. Cunningham. One thing I did want to make a shout out while I was here for a couple of people. Craig Schmidt, he has been working on this child partnership for several years, and he's also with the health department. And I wanted to actually make sure everyone was aware that we do have leaders on this Board of Health that have agreed to co-lead. Serena, yourself, helping with the violence prevention, and Dr. McBride as helping with the intersection of health and economic mobility. And I just think that's great that we have actual Board of Health members here taking leadership roles on our teams too. So thank you.
Thanks. All right, so I know Corey has a question. I see Colleen has a question in the chat. And then I had a question about the one data point on the slide about mental health. It looked as if there was information on, I guess, treatment rate and this, that one, yes. So figure 15, when you say mental illness treatment services by race, and it looks like Black people are receiving more mental illness treatment, that seems counterintuitive to what I hear when I talk to providers. So where is this data coming from? Is this treatment in a specific place? Like, is this just hospital data?
Yeah, so I believe this is just going to be hospital data, not necessarily like specific, like you said, psychiatric services or therapy services, but general emergency room visit data.
Okay. I think that would be very important to somewhere, however this is released, to indicate that, because we don't want to produce a narrative that is different than what, you know, as a field we're actually seeing. So thank you for that clarification.
No, thank
Matt,
you for
based on
that
that,
catch.
and Matt, based on that feedback, can we be thoughtful about the title so that it doesn't mislead, especially from a health literacy perspective? I mean, it's likely that we have legends to support in the way that you were able to explain, but I agree with Serena that that's critical.
Yes, definitely. That's a great catch.
Dr. Bradley.
I have like 3 screens and I'm always trying to find the unmute button. Just to echo a lot of the appreciation and celebration. And hey, Matt, we've worked before on some things, so it's really great to see you at the helm here. And Serena, yeah, just I wrote a note to you to say I wanted to let our prez speak, and I'm so glad you caught that. That was great. I missed that entirely. Very helpful. So the 2 pieces, or a couple pieces, I noted to think about the maternal and child health goals and that assessment, and thinking about the issue of congenital syphilis, the increased rate, particularly among people of color, birthing people of color. So I found an overlap there. If birthing parents are not getting into appointments, I think, what was the you said something about 3 months, or there was a delay. Tell me again about that. Was there
prenatal care within the first 3 months?
Mhm.
Or,
so you were saying that there's a disparity there, right?
yeah,
Yeah.
in the first
Okay.
trimester, yeah, there's a
So I
disparity.
guess the point I'm trying to make is that I'm thinking that there's also a structural problem that there's not assessment and diagnosis and treatment happening before. You know what I'm saying? They're not somehow getting either to care, or when they get in care, they're not getting the appropriate care. So I'm concerned there and wondering if we can pay some attention to that. Yeah, I think those are related issues, and I think that it would point us to some structural interventions, and we need to ask some questions of our health systems and our providers about what's going on there, because it just doesn't make sense in 2023 that that's happening. It just doesn't make sense to me anyway. The other piece is to the leverage point that Imbal raised. I was looking at the graphics, and it seems like it would be helpful to be able to track, you know, the determinants that are connected to those outcomes. So we get the difference, but where we're trying to make the change, are we able to track those determinants and how the change is happening at those determinants? So for example, the cross-cutting themes, Rhonda, that you showed, do we have indicators that will show us that we are making movements at racism and equity, that we are making movements at access to systems and physical accessibility, if we're saying that those are important, you know, foundations for getting to our CHIP priorities? So that was a place that I kind of landed to. And I think I saw it like a little bit in the male and female differences in chronic health. So like, if we've explored what might be the factors behind that, then we can watch or intervene at those levels and see the kind of change that we're expecting to see. And that's that. And then finally, I would really love to see, and maybe this is for our community group meeting, community engagement committee rather, a very, very literacy relevant version, something that could be hung on doors, that we could put in mailboxes. This is a crisis, and it's been a crisis for a long time. And I think we cannot miss the opportunity to let folks know that we're not just out here barking up a tree, right? That this is so real. So I'd love for us to think about that and how we can make sure that a very, very accessible, literate version of the condition, the state of our city and the health of our communities can be shared with folks. Okay, that's all. Thank you.
So Dr. Bradley, you know, I'm going to ask you, because we're going to have this community engagement committee meeting and we're going to be like, what are we supposed to talk about? So are you saying specifically that the communication is about the crisis related to maternal health, or are you saying sharing?
Yeah.
Okay.
If there's a way for us to somehow pull this information, the information from the assessment, and then maybe linked with what we're going to do about it. But something to be in people's hands, or, you know what I'm saying? I think all the places where it's going are the right places. I just want to know what extra push. And then I'm very sensitive to the fact that people are not going, you know, we need to adjust literacy, accessibility according to literacy levels as well. So I don't know if maybe it's a graphic novel, maybe it's a cartoon. I don't know, but we need to make sure that this gets any and everywhere.
That excites me. 2 comments that can really get the new committee moving. And I just want you to know, this is the most engagement I've seen across continuously. The chat is blowing up. I'm very excited. I'm very proud. And Rhonda, I hope you're taking notes for our comments that we will be sharing back with our partners and the state as we finalize, especially things that we can actually use to inform our final document. So Dr. Bradley, there is 3 things. We have hired and we will be announcing very soon our new community outreach coordinator position at the health department. Very excited about the leadership that's coming this way. And I would announce it, but we haven't been able to announce to staff yet. So we will make sure the board also gets an email. While we must give that person time to build something out of nothing, that person will be a great resource to this specific committee on the board, as they will have the coordination of our community outreach as a priority. They will have the implementation as a priority in being thoughtful about our mobile vans that we have not utilized in this way specifically yet. We've kind of done a soft rollout of that being part of that. And then we have, to give a little bit of an update on the first draft, we're going to give you a teaser of our annual report, impact report that Shantae Fluton, my God, you thought last year's was good. Wait till you see this year's. This woman and her skills are something else, okay? And this is just the draft. Baby, this is what the first draft looked like. That's how good the team is, okay? And in tune with the work of the department whilst helping to get accreditation across the finish line. Y'all can't mess with my team. But I lost my track. There's gonna be a metric there that she shows you how much money we invested in community health workers that we have started to hire within the department and that we're subcontracting outside of the department that can also serve as thoughtful ways of the implementation arm. Finally, I can announce that we have a fully executed contract in trying to role model investment in the Regional Health Commission for $500,000, where they will be taking on the work that you started to begin the health equity plan, the first ever health equity plan for the city of St. Louis. As part of that work, we will link them with your committee because some of the comments that most of you have brought up around health equity they will be taking the lead in both this document that must inform the work of the CHIP as well. So I'll stop there.
All right. Colleen, you had a comment in the chat specifically around coordination with internal departments, the Department of Health interacting with the Board of Alders, maybe Human Services around housing. Did you want to say more about
Yeah,
that?
sure. Yeah, thanks, Serena. So it just occurred to me that there is at moments when there is a lot of public attention to a particular area or disparity, that we generally also have an opportunity at that moment to really push for some bold change. And so there has been certainly as of late increasing attention to the city's policies and or sort of evolving policies to address some of the needs of the unhoused community. And so I was just wondering how we are interacting with that, I think, very timely and relevant issue. And, you know, politics aside, I think, you know, science is always a good way to sort of ground values-based interventions. And so I was just wondering if we are working with the alders or other departments, as Serena said, who are prioritizing this work right now.
So we've started with key stakeholders around really trying to provide a more informed, a better collation of the data. So Generate Health is bringing together the two health departments and other key stakeholders to begin at the data level. Additionally, you will see in some of my communications, we will not, I can announce it now, we're not going to have a monthly report next year as we prioritize finishing and disseminating our annual impact report. But because of what folks are seeing in the news, our communications team is working on some communications that can go out as health alerts, our own press releases, and thoughtful ways that we can communicate. Lastly, we are working on the incredible Melba Moore, who opened the door for me to have this position, used to have a specific ward specific newsletter, for lack of a better word. Shantae, how would you characterize it?
So we prepared a ward booklet that gave an overview of the health of an area, specific area, whether it was by ward, whether it was by zip code. And the focus, it was something that started out of the, it was the last, I believe it was the last city CHIP. One of the priorities was violence prevention. And in there, there was a peer initiative from the mayor's office. I know there's a few of you that know the peer initiative that came out. So as a part of that, there were, I believe, 13 areas of focus, and in those areas is how we focused on those areas to develop these booklets. And so it gave an overview of obesity, violence, environmental issues, just anything and everything that you could possibly think of. But it also contained contact information for your older person, NSO, area resources within your ward, you know, so it offered, you know, multiple levels of utility. So it also gave maps of resources so people would know exactly where to go and contact information. So it was very well received, and we look forward to sharing that with you in the future. Mm-hmm.
Colleen, as we bring that back, we'll be highlighting these very critical issues with local data to support their specific wards, as well as the state level situation. But I appreciate the thoughtfulness. I have to present this the CHOD CHIP to the mayor, and I've requested to the Board of Aldermen, at least in the very least to the health committee within the Board of Aldermen, but I think it's important that they all get it. And so depending on their response, there'll be an opportunity for me to do it verbally then. We're going to prioritize this with intention as we reintroduce and update this ward specific newsletter. but I welcome any other suggestions. But yes, we're in the final stages of finalizing a meeting that Generate Health and us are taking the lead in starting about 2-3 weeks ago. Does that help, Colleen?
Yes, thank you. You know, I'm very committed to data and scientifically driven interventions.
If you would like, we can include you in the invites to these meetings and you can join as you're available.
And something else I wanted to mention in the CHIP, the health and economic mobility section is got some sub areas that we're focusing on, and one of them is housing and reducing the barriers to housing. So there have been some policy recommendations in that area with like increasing minimum wage, advocating to increase income eligibility and reduce barriers to regional housing, policy advocacy on reducing barriers to utility resources, increasing advocacy work on FMLA, family leave, disability, and childcare, and things like that. So I just wanted to highlight what that area of health, the intersection of health and economic mobility, you know, goes into.
Thank you. Corey, I see your hand up.
Yes, I'm gonna ride a little more on Colleen's point, because I did have that. I wanted to see in this plan and wonder if there's space where we have this kind of focus on how the other sectors of government, and for that matter, really other sectors, this is a multi-sector, this requires multi-sector involvement. So I was wondering, is there, you know, how do we call attention to that? I don't know if there's like, I don't know what to do with that. Like, I just want to see a little more, see something from governments and those different pieces saying, you know, or indicating this is how they get involved, or some kind of attention, or how they're going to be involved. Maybe that's just a thinking, planning kind of idea. But here's one idea I have. I wonder if in April, during that public health week, you know, where you're looking to do a major dissemination, what do folks think about hosting some kind of major kind of symposium where folks, leaders in government sector are there, public health folks are there, we're all there working through, and from the county and the city in this space, working through the CHIP, and then breaking into groups and thinking about how the you know, HUD is going to respond to this, or how the community services department, I don't know all the different kind of offices in the city and the county, but, you know, like, how can we get those minds together in a space together, thinking together out of this document about how it translates in their space? So that's one. And then the other thing is that I'm in the equity work, our approach was to think about how do we kind of heal, that's what I wanted to say, how do we heal this divide, particularly a racial divide, but so many other divides between the city and the county, that a part of the equity work would be for us to be able to look at each other again and say, we can't exist without the other. You're not well, we're not well, kind of thinking. So I am curious about if you can give me some insight on this process and what it's been like working with the city and the county, and are there pain points, and are there places where we can grow, should grow? What's kind of the assessment of having worked together and brought teams together from both sides?
So I know that's a question to staff, but I want to chime in on the first part of that question, because I've had the experience of being a part of a team where we received a federal grant. The Department of Health received a federal grant that required the cross-departmental participation. So as a part of the grant, we had to put in the MOU that the housing authority is going to do this, the CDA is going to do that. And we were supposed to meet as a team to kind of work on the plan. And the thing that was promising initially is that everybody was talking about a shared goal. Like, we're trying to reduce, this is a violence prevention grant, trying to reduce homicide in this particular area by doing these things. The thing that became challenging, though, is because it was a mandate from an external source, it wasn't always prioritized when there were other things that the departments had to work on. So I agree that the CHIP kind of gives us a good opportunity to say, this is the city's plan. This has been adopted by, whoever adopts it. I don't know if the mayor has to endorse it or the board of aldermen, so that it becomes a part of the mandate of those departments. Because when you just kind of call people together to talk, they will talk, but then they go back and do the work that they have to do. So if there's a way to make this a part of the work that they have to do, then that will really facilitate that type of cross-departmental working that you're talking about, I think.
So excited because it's rare that Dr. Bradley and Serena come together, and I actually have something that is close already planned because my team is immaculate like that. So 2 things that are already in the work. The first is, as part of the rollout, we have tentatively planned during National Public Health Week in April. When this was rolled out last year, it was like a CHIP fair, for lack of a better word. It probably will sound a little bit more passive than what you're suggesting, but it's an opportunity for all of the committees represented, their leads, to be all present in one room, and for other community partners and people to be able to meet. It's not intended to be sort of for the public at large. It's more of an opportunity for all of them to be at the room at the same time and have organic interactions and spaces. What you're suggesting, I feel like, is more active. So I'm going to get to that in a moment. Second of all, we have been approached by the National Medical Association, which is the longest serving body in medicine that represents Black physicians in the United States of America. Their president has asked me to host a summit in the first quarter of next year around maternal child health that they will fully sponsor. We have already started the early stages of planning for that, and my hope is that we'll be able to see it across the finish line. Without a formal agreement in place, I cannot assure you that it will happen. As you can imagine, that has a lot of things, but the fact that we were even highlighted and that they asked me specifically to be the convener, and their national president wants to be here for that. The mayor has already shown her support. So as that, the preliminary suggestion was going to be like a town hall of sorts, that we would humbly ask Harris Stowe University to serve as the location. But I had also said that we could either do a more passive, like community fair type approach, but it's very close to Black Maternal Fetal Health Week already. And so in speaking to a few of the leaders preliminary, Dr. Dineo also had a similar suggestion as what you had. So I'm saying that there's 2 opportunities already for things that are already in play. A national one where our department is, the health department is the first health department that NMA has approached for such a partnership, and the opportunity for who will be convened for that versus the already scheduled National Public Health Week sort of fair. There is time to consider, and there is time to also add to. My caution, and where I will never, ever throw my team in front of the fire, is sometimes board meetings become about 20,000 suggestions and no real thoughtfulness about capacity, scope, and those types of things. So my caution would be, if you don't see this happening in the way that you want, or if you have intention about how this is implemented, then we need to have a longer discussion about capacity, right? Rhonda was the only person doing this until Shantae came back to the city. It is unbelievable that mostly 2 people would bring across reaccreditation from the city health department side. For that reason, all the other things we're suggesting are just not even feasible if that's all we have by way of capacity, right? And so obviously we have all these stakeholders. Obviously we have this regional partnership with the county. So there's opportunities, but capacity is and will always be an issue with all the other priorities that they have, because they have other jobs that aren't just this. So I'll cede my time and welcome any feedback on what you heard from me.
Point of clarity, when you say capacity, are you talking about to put on the event that the medical association asked you to do?
Dr. Bradley's suggestion, if it's independent of what we're suggesting,
Oh.
and if for any of the other suggestions that they're new things, we have 2 people in the whole department who also have about 9 other roles, right? Like 9 other priorities. So I won't be able to implement all of those things unless there's thoughtfulness about other partners or other innovative ways to increase our workforce capacity. Does that make sense?
Yeah, that's why I'm bringing it to us. I don't, just to kind of generate some thinking. Could we?
I know, but
Yeah,
I have to say on this live call that's broadcast.
Got you. I'm with you. Yes, yes, indeed. Heard.
Just calling us to help you, Dr. Mahdi. That's what we're saying. So.
Caw.
I thought I saw someone else put their hand up, then I don't see it anymore. If anyone else has a question, just unmute. Oh, Colleen, you're breaking up.
Also, oh shoot. Let's see. Can you hear me okay now?
Yes.
Okay. If I get broken up, I'll just put in the chat, so just let me know. I was just going to lift that there is also a fair amount of attention and resource allocation at the state level around maternal and child health right now. Dr. Mahdi, you probably know Dr. Heidi Miller, who is the new-ish CMO at the department, and she has been working very closely with ACOG, for example, on a number of maternal and child health interventions and sort of
I think we lost her.
I'm so sad we lost you, Colleen, but when you rejoin, we can uplift those comments. But yes, I do know Dr. Heidi Miller, but I did want to hear more about what you were going to say.
I will just add that, Heidi Miller is a big champion. Also, my colleague Abby Barker works half with WashU and the state, and she's been pushing these. We've done a report to our center. Colleen's back. I'll let her finish.
Well, I'll try, but in any case, the state has a lot of interest and support, both in capacity and resource right now allocated to maternal child health. And so we at ACOG have been working, American College of OB/GYN, with Dr. Miller on a number of priorities. And if we're thinking about sort of physical capacity as well as manpower capacity, that might be another place for us to partner. Even if it's a locally driven, but then effort we could expand the state. Again, absolutely 1%.
Colleen, while you were breaking up a lot, the power of your voice and conviction came through, and I actually think I caught all of that message. If you could do me a favor and do an email between me, you, and her so that Anika can schedule a meeting to do just that and start talking about how we can start to actionalize this. I would appreciate that. If you could send me an email today so Anika can work on scheduling between me, you, and Heidi. Thank you.
All right. Any other questions on this topic?
This may be my favorite session we've ever had, and I am happy to cede or even remove what I had because it was only going to be a teaser anyway, but this was brilliant, fantastic. Rhonda, good luck capturing all of this. I need screenshots of the comments, girl. I need STL TV for us to download the recording because it'll be live, but this was phenomenal. So thank y'all.
Okay.
And Matt, in the word of the youth, you bodied it. Congratulations again.
Is that the word of the youth now? That seems kind of.
Wow,
What?
Serena. Wow, you could have let me have it. Okay? Because other people weren't going to know. I knew you and Corey would know, but Corey was going to let me have it, and he was just going to look me up in the text, right?
It was the now for me.
Right.
It was now.
Right. Did you see how she lingered it? So I'm actually glad that I trust in your authentic and honest leadership. because that I will never forget and I love you more for. Just know that the Corey Bradley was going to light me up in the text, but I said what I said. You bodied it, Matt. And the youth of some generation said it.
There you go. That's a nice disclaimer. All right. So, I mean, we're scheduled to go until 9:30. I will say that the board committee updates will be light. So if you would like to do your departmental update, we do have time.
Sure, I'm going to keep it brief because it's a teaser, but it's just too good not to share. Shantae, I thought I had it downloaded. Could you share screen with the most recent version that you sent of the impact report?
Sure, one moment.
And I'll ask you to scroll as I'm talking. So again, Shantae Fluton extraordinaire on your screen right now is responsible for what you're about to see. It is almost final. The only things that may change are likely formatting and a few other things. But I wanted to prepare you because I have made a change this year for the first time where with intention, I'll be skipping a month of a monthly report to allow for completion and thoughtful dissemination and a wider distribution plan. We've already been talking with the Center for Implementation and I've forgotten Alvin's group, Corey, I'm tired, but
D&I dissemination and
Thank
implementation. Thank you.
Those folks who have offered for free to provide technical assistance for getting this across the finish line. So look at how pretty it is already. And I'm just gonna have you scroll through. There's gonna be a fun little message from me, read it. We talk a little bit about you, read that, and your names look pretty. Look on the seal. Come on now, formatting. But there are similar elements from last year that you will see. So we have, if you could stop at funding. Last year, we only talked about the funding that came from the general budget from the city. And we account for just under 1% of that. This year, we have added the additional, it can be misleading to folks who don't understand how that works. So last year it would have read for like the 16 million and I didn't want people to think that's our full budget. So this year we'll be reflecting our total budget and you can tell that 52% of that is accounted for through state and federal grant funding. So that will be one change and I wanted you to understand why. If you could keep scrolling. This was a part of last year, so it's updated numbers and a few more narratives around workforce. If you could keep scrolling. You're gonna see this will be new. Where were we in community and what were some of the things we thought were priority issues? You can keep going because I can already see Dr. Corey Bradley leaning in and this is a teaser. I ain't having it today. This is one of my favorite new pages. He leaned in like this, like your eyeball was in the camera, friend. This is a new page that I'm real proud of. It's such a flex. We have been intentional in ways that we weren't equipped to, but because of the work of our new commissioner, the Victoria Anwuri, you're going to see a lot of the work that she does and how she leads reflected in this. And this page reflects that. The amounts of money that we have increased to put it back into community and the work that her and Craig do to make sure that happens in a timely, equitable fashion. More on that for next year to come. But these are some exciting numbers about how we are investing in community after getting direct feedback from them. Then we can scroll through this quickly. Each bureau will have a bureau at a glance with the numbers first. So you're going to read CD with the bureaus at a glance and their numbers. And then some of the narratives that support our strategic plan highlighted in this. Some of this may look shorter because this is still wordy, but you will see either all or some of this in the final iteration. So every bureau has a more consistent pattern because of Shantae's innovation and a direct link to the strategic plan because one of the places of feedback we got is that last year that wasn't clear or a little confusing. You'll get a CHOT CHIP update. We'll talk about how we are leading locally and nationally, and we will talk about where we've been in community. The accomplishments page you saw from last year. There's like I said, the CHOT CHIP page as well. is more fleshed out and has to be because we're about to submit. And then we'll end it with contact information, etc. So again, this is a teaser. I'm making this teaser available because of the rollout will go as follows. You will have this in hand either between or just before the next board meeting. And my goal is that there will be no presentation from me at that meeting. There will be no additional fun presentation. I want everyone prepared with at least 2 reflections on what you loved about the report and stood out as a positive, joyful, because that's what this is about. It can't always be about critique and what you didn't see and what you think is problematic and how the house is on fire. We're gonna celebrate with intention. And then at least 1 caution or question or feedback about it or things that it evoked in you. That is how I would like to structure this with permission from our president. So there will be no formal presentation, just an opportunity for you to really be able to read, reflect, and come back to really talk about this in a way where this live report can be another way that community can receive from this plan that we're going to try to be more intentional about dissemination. I'll stop there, and congratulations again to Shantae and her team for this incredible effort. Shantae, anything I didn't say that you'd like to say?
The only thing that I can add is that we also were intentional about, we do know that we're going to be sharing it electronically, as well as there will be a limited number of print that will go out. But in the electronic form, there will be hyperlinks embedded for different documents or different areas where we'd like to share additional information. So you can also get that extra added bonus link. So, but we're really excited about, we're really pleased on where it's going and look forward to sharing the final with you in December.
Shout out to our fave, Kristen, who is affirming that joyful is a good theme for December. I agree. Sorry, questions?
I don't see any hands up. Thank you. I will say the draft looks very clean. Like, I like visually, it's very engaging. So we will go to our board committee updates. I think we had quorum and now we don't.
Yeah, I think that's right,
Okay.
Serena.
So I missed the opportunity to vote on the video minutes. I will encourage folks, you can download the chat at the end of the meeting. So if there are points that we want to remember, links, things like that, because I don't know that everybody goes back and watches the video, but the chat sometimes can help us remember some of our key discussion points. All right, Tim, you're first.
I don't think I have an update unless Craig tells me I do, but Craig, maybe you can bug me to schedule another academic partnership meeting.
Sure. And I know obviously the department, the commissioner and the director obviously are working on other matters, and we probably need to connect those dots.
Yep. But we made some good progress already, I think.
So I will say, for governance and nominating committee, we have been interviewing potential candidates. We're still looking for candidates. We will have lots of openings next year with folks terming off of the board and then some folks relocating. So as you meet people in community, please encourage them to apply to be on the board. The first step really is just to email us and let us know that they're interested, and then we reach out and have conversations with folks. And after that, if they want to proceed, there's of course an application through the city's website. But we really do need additional candidates. I will say we have lots of candidates from our 2 wonderful universities, and we cannot have a board that is only university representatives. So you really need some folks in the community as well.
Yeah, Kristen, can I ask a question about that? Kristen, do you work with community health workers, right? Do you do that?
Do I do community health work?
Yeah, like you work with that group of folks, do you? Or you have a close connection to them?
I do have a close connection. In fact, I have a meeting today with, actually, my connection is through the IHN.
Okay.
So I'll be talking with their director lead, and I have been sorting out we have community consultants
Okay.
that we use from Alive and Well, RHC, whatever we're calling ourselves these days. But I have reached out to some of our consultants who are strong community leaders to see if they would like to be a part of the board. And I'm still kind of sorting some of that information because those voices are so important in this space.
Thank you.
So,
Yeah,
of course.
They've had a direct link there, and that would be great to see that representation on the board.
For sure. Thank you, Corey.
There you go. You got it.
All right. And then our other committee, the Community Engagement Committee, we had our first meeting. We meet the first Monday of the month until we change the date. And it may be changing because of, schedules and that kind of thing. I will say, if you are assigned to a committee and your committee has not met, or you feel like you have bandwidth to join an additional committee, you can serve on more than one committee. So if you're interested in also serving on the Community Engagement Committee, please let me know. We can make that addition. And we will also be looking for a chair for that committee. Kristen, I got you. Thank you very much. So right now, I'm just kind of facilitating until it has a permanent chair. So that is our update for now. All right. Any announcements? Not. Our next meeting is, well, it's supposed to be December 21st. And I wonder, is that too close to holidays for people? Are folks going to be working on the 21st? Do we need to cancel, do something else? What are folks thinking?
It depends on what we're going to be doing in that meeting. Is it a regular meeting or we having a little eggnog? Like, what's going on?
That's up to the group.
We can't put that on YouTube though.
I would love to discuss, we haven't seen each other in person in a while. Would love that if the opportunity presents. There's an opportunity to simply, in a way that doesn't overwhelm people, convene in a space that allows us to enjoy each other, have a little bit of conversation about the impact report that can be very informal, but also eat. We can, if we can't get it to that extent, even if it's just a little informal potluck, or we meet at somebody's restaurant, child, and they give us a little room and we all order our little stuff, whatever is the easiest lift. But I know that I will be on vacation starting the 20th. So if it is on the 21st, I can virtual in from Michigan, and a full Davis household in the background may not be
man, I want to see that.
but yet and still, I'm happy to comply with whatever the president and the group think.
So I think what I would probably need to do is a poll for availability if we do need to change it from the 21st. And I think having an in-person gathering would be great. I don't know if it needs to start at 8 a.m., but we'll see. Anything else on that? All right, so I will send something out and see what we can get scheduled for December. This meeting is adjourned. Thanks, everyone. Don't forget to download the chat if you plan to do that. I almost did.
Rhonda, do you have what you need?